I asked 20 doctors to share their least favorite part about their job. I'll go first.
Welcome, everyone. My name is Dr. Mo, and I'm a licensed dentist. Today, we will be discussing the worst part of being a doctor. I'm a dentist, so I'm a doctor also. If you think otherwise, please subscribe and turn on the notification bell.
Not knowing the cost of treatments and tests for my patients.
So it's actually true, and even if let's say like the cost of a particular investigation, it's going to vary between insurance providers, and also not only this, there are patients that don't even have a health or dental insurance, so the cash cost for the investigation or the particular treatment is going to even vary between health facilities to make things worse. So I agree with this.
Make it really difficult for me to be an effective doctor. I can have all the answers in the world, but if my patient can't access this test because it's ridiculously priced, which happens very often, then I'm not actually helping them, am I?
So that's actually true, and it's even more true for like people who are specialized and they need a very particular specific test that would be most probably even, I would argue, critical for them to formulate an appropriate treatment plan for you. So it's extremely unfortunate that sometimes there's that cost, obstacle that's in the middle.
Because of our complex hybrid healthcare system, I have no idea what the costs are for anything these
Hybrid.
days, and that's how most doctors feel.
My name is Dr. Anthony.
So I agree with this. As I said, as a dentist, sometimes not only the cost itself, but that huge variation between healthcare facilities, pharmacies, and so forth. Even for medicines, if I'm not mistaken, like for each medicine, there's like pharmacy that sell it for X price, the pharmacy that sells this for Y price, and this one marks it's up by this amount, this one marks up. And for there's certain things, if you talk the global scale, like the same drug could cost X amount of money in country A, and it could cost a much higher amount of money in country B. So it's a bit ridiculous.
And I'm a board certified.
But we're talking about things within the context of like the same literal even city or country.
Plastic surgeon. My least favorite part about being a cosmetic plastic surgeon are the male companions of my female patient.
So do you actually agree with this? So I'm assuming he means there's a female X or female Y and there's her male companion, just like trying to interfere with her treatment plan or desires, I guess. And he says it's the worst part for a plastic surgeon. And why can I, to a certain degree, or let me just say not I, but perhaps dentists may relate with this to a certain degree, and reason being, dentistry has an entire industry of cosmetic dentistry also. So not only like plastic surgeons, but dentists do a lot of cosmetic work. And the male companion can interfere to a certain degree with a treatment plan or what the female patient may get. Now, for me personally, I do not see a lot of this, but I'm pretty sure this is something that actually exists.
I can't tell you how many times I have sat there and listened to a guy tell me what a woman should have done. Sometimes I honestly just want to slap them.
Okay, I wouldn't go that far, but I guess that's what he said.
When a guy tells me she needs liposuction, I really just want to turn to him and say, why don't I liposuction you?
Hi, I'm Dr. Benjamin Schmidt, also known as...
So Doc Schmidt, also, most of these are not only doctors, but they're influencers on social media. Not as good as I am, said in a humble manner, but they're doing well.
Doc Schmidt, and I'm a GI doctor, which means that I specialize in gastroenterology. In rare cases, the colonoscopy prep doesn't do a good enough job cleaning out a patient's colon, and there's sometimes even identifiable food in there, like corn. It's always corn. But then I have to use a tool, kind of like a micro power washer, to try to spray all that leftover gunk and poop off the walls of the colon. and suck all down so I can actually see and try to look for polyps. It's super gross.
Hi, my
Okay, so that doctor is hilarious. I mean, I watched some of his videos. Now we have the master,
name is Dr. Winters, aka the Dentist Online, and I'm an
Dr. Winters. Probably first time I know his name. I just know him by the dentist.
orthodontist. The least favorite part I have of my job is the fact that when you go home with braces, I can't control what you do with them.
So this is actually true not only for braces but for other dental treatments. Like if we just did a full mouth cleaning, i.e. scaling and polishing, full mouth scaling and polishing for you, where we removed the dental tartar, the plaque, all of these things, we cannot really interfere with what happens once you leave the clinic, right? We rely on you to follow proper the oral instructions that were given, right? And take care of your oral hygiene.
Can't control what you eat. I can't control if you brush because a lot of people.
I mean, you don't need to be that much controls. Okay, so finally, teeth, my favorite part. So what I can see is there is white, chalky spots, and the problem with this, it appears to be like an initial stage of caries, or rather looks like a stage of demineralization. And also there's a cavity here. The gums look to a certain degree okay, albeit it looks like the patient's not taking care that much of their oral hygiene. So just a small thing to say here, this is called the attached gingiva anatomically, right? This slightly more pinkish area, and this is called the alveolar mucosa. Weird names.
White nasty spots around their teeth, the decalcification or cavities.
Yeah, so decalcification to the surface of the tooth is losing minerals. Is part of these minerals the calcium, and hence we say demineralization. Areas of demineralization is saying decalcifications, and as we mentioned, there's a cavity there. It's quite obvious. You can see also if you look a bit too closely, perhaps the small red spot. Again, it could be a bit of bleeding. It's possibly from the gum due to the poor oral hygiene, or because it looks like very far from the tooth center. So I doubt if it's anything related to the pulp, and pulp is more toward the center.
And I wish I could just go help them. And as much as I tell them, they just don't do what I want sometimes and end up with those white spots.
I'm Dr. Danielle Jones. Some of you may know me as MDJ, and I am an OBGYN. That means I take care of anything having to do with periods, pregnancy, and the female reproductive tract. Pregnancy and birth are expected to be, and honestly are, a very happy time in most people's lives. But when things are bad...
So, fun fact, there is actually something called as pregnancy gingivitis. Gingivitis as in the inflammation of your gums. The gums are these pinkish structures that we talk about that are near your teeth. And part of that happens because of the hormonal imbalances that a pregnant lady goes through. So there's a literal term called pregnancy gingivitis.
In this field, they are often heart-wrenchingly bad. I am always so honored to take care of patients experiencing loss, but at the same time, that is a really difficult part of my job.
The least favorite part of my...
Okay, so Dr. Karen is a doctor in the UK. Let's see what he has to say. He's a general surgeon.
My job is unfortunately something that I have to do relatively frequently. It's break bad news to patients, often giving them a cancer diagnosis for the first time.
So it's actually true sometimes, and you need it's like a specific skill set, a communication skill set to make it clear to the patient there's any bad news that they should be aware of, and how to inform sometimes the parents or whatever people with that patient.
Or telling someone's relative that a patient has passed away. But the way you break that news is important. You can provide the patient with some hope, optimism, some safety, confidence, security, and just give them some dignity and respect and make them feel comfortable, often at their lowest point.
Hi, I'm Dr.
Yeah, so just be supportive with the patients, reassure them. Also be realistic, just have a proper way of communication when you're communicating any bad news to them, and have some empathy, be considerate of their emotions. Dentists, or I myself as a dentist, have to be we have to be really unemotional, especially when we're giving news, when we're seeking, because we cannot panic, right? We to always stay in control. Like sometimes something unexpected may happen in a procedure, but if you planned your procedure properly and you're doing evidence-based dentistry, extremely small percentage of your procedures are going to have something unexpected quote happen in them. But sometimes there's a patient factor, like the patient just all of a sudden flinched or moved or fainted or whatever, emergencies happen.
Von Deschauer, also known as Violin MD. I'm an internal medicine and rheumatology specialist. I'd have to say the 24-hour call shift. I love.
Yeah, it's definitely extremely exhausting. I don't know a single dentist who's on a 24-hour call. However, I'm not sure about the oral and maxillofacial surgeons. Actually, most of them are working mostly in hospitals or bigger healthcare centers. That is, I don't know, positive for us that we don't have 24-hour shifts. However, that being said, I have a relative who is a dentist. There goes my uncle, a dentist, part of the video. And he used to work for a particular hospital, and actually he was on call, but he wasn't in the hospital. So it looks like they gave him something that would ring, like a pager, I guess, or I don't know. And whenever they needed him for an emergency or so forth, they would call him. You may say, what kind of emergencies can a dentist face? There's a lot of emergencies where a dentist can step in, right? Like a bleeding in relation to the mouth, tongue, the lips. We can help in controlling that bleeding. There's also emergencies into in relation to a patient with a large, we call it odontogenic infection, meaning odontogenic as an infection with a cause related to the tooth. Other things, there's a case called Ludwig's angina, and this is not the angina that most of you are familiar with relating to the heart. Ludwig's angina is where the tongue becomes swollen and your tongue is blocking your airway. And this is also an emergency where dentist has knowledge and expertise to help in the emergency center or emergency room, the management of these emergency cases.
Of the excitement and camaraderie in the middle of the night, but I know how tough the lack of sleep and stress is on the body, and I hate feeling like I'm having a negative impact on my own work.
All the BS. Favorite part of my job is dealing with insurance companies and paperwork.
So it's actually true, but that being said, I'm very good at playing chess with the insurance companies. So I know what to do and how to do it, and also we normally have certain specialists. If your dent clinic can employ some who really understand like the insurance codes, treatment codes, and all of these things to help communicate the same literal case that they would reject otherwise, but like to cover it.
All the BS, paperwork, and administrative tasks.
So he says BS, paperwork, and administrative tasks. However, I actually kind of disagree with this because it depends. So with regard to the patient documentation details, like the procedures, what happened, the discussion between you and the patient, I think these are extremely critical. The documentation of each step, what happened, and all the things that were disclosed between you and the patient. I think all of these things are of uttermost importance. Is there some extensive paperwork? Well, I guess depends where you work and what he is exactly referring to. Let's see.
I have to do
dealing with insurance companies.
gosh, and
They just got cut off. So most doctors are complaining from insurance companies.
insurance companies really give doctors the runaround.
I got into this profession to actually hang out with people as opposed to focus on medical documentation, which is absolutely
So as I just said, I largely disagree with this. I don't have any issues with medical documentation. Just learn to type faster with less typos.
important. So that includes insurance pre-authorizations, calling around to a bunch of.
Yeah, so that's what I said. So there's also insurance pre-authorization. I mean, it makes sense. Why is that? So because there are certain, I don't know if you want to call them doctors or what, but who really abuse the system, and they may send some wrong claims or try to find a way around these things. So there's a reason why these authorizations exist, and all of that documentation. Can it be tiresome sometimes? Of course it can, but it's just part of the job.
Pharmacies coordinating really complicated outpatient care.
The insurance denies their surgery because they haven't done 6 weeks of physical therapy.
The list goes on. It is so frustrating.
Sometimes the insurance may deny a particular treatment for a ridiculous cause. I agree with this.
I hate having to deal with insurance. Yeah, that's it.
Hello, my name is Ed Hope. I'm a doctor working.
By the way, not all insurance companies are the same. Some of them are quite smooth to deal with. I mean, if you think about it, at the end of the day, not all patients who pay for dental or healthcare insurance actually use it. That's how the insurance companies make their money.
The emergency department over in the UK. Most people looking into medicine would probably say dealing with things like bodily fluids, but you kind of get used to that. The hardest thing for me at the moment is working in the NHS. Although the NHS is much loved by people in the UK, it's a failing system through years of mismanagement and underfunding by the government, meaning we can just about provide safe care, but certainly not close to the care you want to provide.
So I can't really comment on this because I don't live in the UK, but I think some patients complain about having to wait long for their appointments, and some doctors there being overworked. Again, I didn't work or live there to say for sure, but it's definitely a thing that some people complain about.
Or the care that patients deserve.
My name is Ricky Brown, and I am a board-certified plastic surgeon in Scottsdale, Arizona. My least favorite part of my profession is that everyone expects that I drive a Ferrari, and I just want to drive my Toyota Tundra. Can a guy...
I mean, Toyota Tundra is not bad also. Also, Ferrari, how much does a Ferrari cost? I looked it up. Honestly, it's a lot of people going to be surprised. It's not that expensive. I mean, how much is a Ferrari? How much a Ferrari cost? I'm just looking it up. It's like $300K, dude. It's not
I
that.
just drive his truck and not be expected to drive some Rolls Royce or Ferrari?
Hi, I'm Dr. Rina Malik, urologist and pelvic surgeon, and a urologist is essentially a surgical and medical doctor of the genitourinary tract. The least favorite part of my job is how little time we get with patients, particularly patients who come to me with issues about sexual health or intimate problems. They need time to.
So, it really depends which specialty are you in. For dentists, we don't really have that issue, to be fully honest with you, because already each dental procedure takes some time. So we spend particular amount of time with each patient, depending on how long the procedure needs and how long we need to have a discussion with the patient. And also our favorite thing to do is to talk with the patient, especially when they're not able to talk. There are instruments or a rubber dam on their mouth so that they make sure they're not able to talk.
Be comfortable.
I'm kidding, of course.
What's wrong with them, and also to build a secure and trustworthy.
In my 3rd year of residency training.
The least favorite part of my job is that mental health stigma can prevent people from ever seeing a psychiatrist in the first place. Although it's gotten a lot better, there's still a ton of media to fight stigma and educate people about mental health. Strongest things that you can do.
So I don't know what do they mean by mental health stigma. I assume people being scared to see a psychiatrist or something, or like, I don't know, there's a stereotype around it. I'm not sure. But definitely, if somebody has a psychology problem or they feel unsure about their psychological state, we should definitely encourage you to see a psychiatry specialist.
What up? My name is Dr. John Patton, Doc JP3, and I'm a board-certified anesthesiologist and a regional anesthesia and acute pain medicine specialist. What is my least favorite part of my job as an anesthesiologist?
So anesthesiologists are probably one of the most respected specialist doctors, and they play an extremely critical role in the operation theater. And also, when anything goes wrong with the vitals, sometimes the fingers are pointed, as in like this finger, index finger, on the anesthesiologist as to look for them to save the case.
Many people still have no idea what we do.
So that's actually extremely true. Most of the time, if you had the procedure, you either did not see your anesthesiologist, or he just saw you to discuss with you the risks of the type of the anesthesia that you're going to have, i.e. if you had a general, if you were going to have general anesthesia or sedation or whatever, the anesthesiologist will come discuss these risks with you, and it's probably the only time that you may see them. And you probably wouldn't want to see them, because if you're having an operation, you don't want to wake up in the middle. Guess what? Some people wake up in the middle of their operation, even under general anesthesia.
Hi, I'm Dr. Patton. I'll be your anesthesiologist today. Hi, Dr. Patton. Are you going to give me the Michael Jackson drug today? As anesthesiologists, our primary job is to keep you safe. We can be found all over the hospital, from the OR to ICU, surgery centers, labor and delivery. There's a saying that goes, keep calm and call anesthesia.
There are bad parts of being a doctor, but there's also...
Yeah, so that's all for today. And the worst part, I'll answer it for myself, being a dentist, is that sometimes the patients may not understand that there's a patient-related factor to the long-term success of the dental treatment. What does that mean? The dentist's job is done in the clinic, and also done when the dentist clearly gives the patient the instructions that they need to follow. But also the patient's job is done at home and in the rest of their life to follow the instructions. So follow the instructions and turn on the notification bell and like. Thank you everyone for watching. The My Dentist out.